representation from across the system, and all of them representing the voice of service users. So there's some good progress happening there. In alignment for this particular action, the Better Care Fund is reviewed annually, and plans are being submitted in line with the planning guidance each year. So at the time of writing this update, they're still awaiting release of the Better Care Fund planning guidance for 2022-23. If I move on to the next priority area for priority 1, the priority action, apologies. This is around using information and intelligence to identify the communities and groups who experience poorer outcomes and ensure the right services and support are available to them whilst measuring impact of our work. Again, this is progressing well, and we have a green status. A population health management approach is being used to inform the priority areas of work. And the aim as well of the Better Care Fund and the board is to enable integrated working for the best use of these resources so that we can enable care that is tailored to the needs of individuals. In terms of the key indicators from the population health management dashboard, I'll try and summarize these because if you look at it, there's a lot of information there. But in terms of a summary, a range of conditions that are linked with early mortality and disability are made available, and details about how the PCNs, the primary care networks, and GP practices in the most deprived communities in Reading are affected are provided. So I'll explain how we're being impacted in these particular areas. So in relation to cancer, cardiovascular disease, diabetes, obesity, and respiratory conditions, at baseline, relative risk is slightly lower or similar in deprived areas in Reading in comparison to the wider NHS commissioning area. So we're doing okay with regards to those particular areas. However, with mental health, relative risk is slightly higher in deprived areas in Reading in comparison to the wider NHS commissioning area. So a target is being set to reduce this in line with the wider area going forward. So it was really great to hear from Lara, who was presenting on the work that Compass is doing, because mental health is appearing to be an area that we need to put some more focus on. We also are using data from the ICS Insights Evaluation Dashboard, and this shows the proportion of people living in Reading with a condition who have received all the statutory health checks recommended for the condition within the recommended time. And so far, the data indicates that across various conditions, including cardiovascular disease, mental health, learning disability, cervical screening, and diabetes, we have actually improved with more people receiving checks within the recommended time period compared to our baseline. However, it's important to still know that with cardiovascular disease, the data for Reading residents still indicates that some areas of deprivation with higher risk scores have higher risk scores for cardiovascular disease. And another point to note around mental health is that the data is showing us that there's a high prevalence of low-level mental health issues, particularly in areas of deprivation. And I'm aware that there are projects to address this that will be developed through the Reading Integration Board program of work, as well as the work that Compass is doing, among other organizations. With regards to dementia and asthma, the proportion of people receiving checks within the recommended time period has reduced. So in other words, that has not improved. So this is an area that we should keep an eye on as well going forward. So I'll move on to priority 2, and just being very mindful of time, I'll try and focus on the key areas, and we'll see how we get on. So priority 2 is around supporting individuals at high risk of bad health outcomes to live healthy lives. So again, the RIB board leads on this, and they have provided an update focusing on actions on identifying people at risk of poor health outcomes using the population health management data and local data sources, as well as signposting to relevant services and improving access for people at risk of poor health. So again, status is green. Similarly to the previous action, the population health management approach is being used to support this action. as well as data from provided from Connected Care, which is being used for case finding based on specific conditions. Once these cases are identified, these are then discussed at the multidisciplinary team review panels to ensure a holistic approach is taken to supporting these individuals and to avoid hospital admissions. The following two areas of updates around raising awareness and understanding of dementia, as well as working together to reduce the number of rough sleepers and improve mental health and physical health through improved access to local services. For both these actions, we are in the green, doing really well. There is a health checks program that is taking place with a focus on increasing the number of condition-specific health checks that are undertaken for vulnerable groups. In particular, this includes those with dementia. Okay, so with regards to key indicators for priority 2, as it stands in relation to inequality in life expectancy for both males and females, this inequality has reduced in Reading, which is really positive. And in relation to the rates of diagnosis of dementia in people aged 65 plus that are estimated to have dementia, although was slightly increased since our baseline, we are, we're still within an acceptable range there. And then the number of people who are sleeping rough, we haven't set a target for that because ideally we don't want people to be sleeping rough. However, where we are to date is we have 22 people that we're aware of within Reading. So I'll move on to priority 3, and this is around helping families and children in early years. And this is being led by the One Reading Partnership Under 5's work stream. And the areas that they provided an update on are in relation to exploring a more integrated universal approach that combines children's centres, midwifery, health visiting as outlined in the Best Start for Life report. So there is some really good work happening there, and the aim is that there will be some work that collaborates with maternity, health visiting, breastfeeding, safeguarding, and SEND, as well as the mental health teams to essentially offer what is proposed in the Best Start for Life. The remaining 2 actions that fall under priority 2 that have been updated on include working to provide evidence-based support for mothers, fathers, and other carers to help prepare them for parenthood and to improve their personal and collective resilience during pregnancy and throughout the early years. So again, there's been some good progress in this, and a new suite of parenting support is being rolled out in children's centres, which is really brilliant. And this provides evidence-based programs for pregnant women, new parents, and parents of toddlers. Alongside this, there is a newly devised course for expectant dads that's being rolled out and facilitated jointly by children's centres and maternity services. And then last but not least, under priority 2, there is an action around increasing the number of 2-year-olds who experience disadvantage, increasing their access to nursery places across Reading. So work continues to support the increase in uptake for 2-year-old funded entitlement. The Parent Champion initiative is to be expanded over all areas of Reading, with a further 3 champions to be recruited by the end of this month. So there's some really good progress taking place under priority 2. Moving on to priority area 3. So as it stands, with regards to hospital admissions caused by deliberate and non-intentional injuries, this is one of the key indicators that we've used to monitor progress. We are doing well, and our rate is below the national benchmark, which is positive to see. And in addition to this, we're also doing well in relation to the percentage of aged 2 to 2.5-year-olds receiving the ages and stages questionnaire. So again, we are above the national benchmark, which is a good thing. Okay. We've also got really good uptake of trauma-informed training by early years practitioners. We set a target of 100, and the latest data has shown that we've hit that, and our current position is 100. And finally, we've also got a target around the number attending parenting groups including the National Childbirth Trust hostel-based groups and English for pregnant women who don't speak English. So this is a new target, and we set it at 50, and currently we sit at 23 completers of this program. So we're heading in a positive direction with priority 3. If I move on to priority 4, this is around promoting good mental health and well-being for children and young people. And I know this was discussed earlier in the day at the start of the meeting. So again, really happy to provide the update that there's some good progress taking place. In particular, 2 areas have been updated on. The first being providing early intervention for children and young people with the right help and support at the right time. So we have the mental health support team, which is working with increasing numbers of children. And our second mental health support team staff are in training and will be live by September this year. Our primary mental health team are working with children and young people with more complex needs as well. And we still have our educational psychologists that continue to support schools on various courses as well. So really good work happening in that arena. The next action is around supporting settings and communities and being trauma informed and using a restorative approach. And again, we're progressing well with this. There is training being offered around trauma-informed, that trauma-informed area. The therapeutic thinking schools approach has been rolled out to 53 schools so far, with over 300 lead tutors being trained. Of trained schools have had further training in trauma-informed thinking schools. Behavior management toolkits have also been shared amongst other clinics that continue to take place on an ongoing basis. So this is evidence of some really great work that is taking place, and we continue to work to build on these. The other areas that are highlighted under this priority area are also green, but I won't go into detail. Hopefully people have had an opportunity to read the report. But I will move on to the key indicators and just provide a really good summary there. With regards to the percentage of school-aged children with social, emotional, and mental health needs, children in care, and the percentage of children looked after whose emotional well-being is a cause of concern, we are currently slightly higher, ever so slightly higher than the England benchmark. However, due to the COVID pandemic, the England benchmark is expected to increase significantly. So we will be adapting our local target to align with this. And then finally, if we move on to priority area 5, which is around mental health for all adults. The mental well-being group leads on this particular priority area, and the areas reported on are amber at this current stage. However, just as a form of an update, there have been 3 task and finish groups that have been developed in order to address the actions within this particular priority. The task and finish groups are looking at assessing the current resources and provision and whether they are culturally appropriate for the Reading community. Another task and finish group is linking in with some work taking place with the loneliness and social isolation group, which has relaunched this month, and they're finalizing a refreshed action plan, which will contribute to the actions within this priority area. And then last but not least, if I just quickly do a run through of the key indicators of priority 5, with regards to self-reported well-being, so the percentage of people with high anxiety, we are again slightly higher than the England average. So our percentage is 24.49 and England is 24.15, so ever so slightly. We are doing quite well with regards to self-reported well-being, so the percentage of people with low happiness, so this is better than the England average. And then finally, the percentage of people who feel lonely often, always, or some of the time, again, we're doing better than the England average. So overall, we're doing well, but where improvements are needed, we're not too far from the target areas. However, As mentioned before, there is evidence of a greater need in relation to lower level mental health and a little bit of a focus around dementia and asthma. Thank you.
Thank you very much for that very informative update as well. We'll note the updates on each priority area, and it's helpful to see the performance that you presented in dashboards. I've just quite quick question. I couldn't see from the report whether any of the actions are delayed and at risk.
So how we've been approaching it is a number of the actions are actually being taken forward, but we obviously didn't want to sort of provide a very hefty, long report. So we've decided to offer up an update on about 2 to 4 actions at each meeting. And the way that we will be, sorry, I will answer your question, but the way that we will be updating going forward is every quarter we will provide a detailed narrative report and hopefully cover as much of the actions as possible. And then twice a year we'll provide the dashboard. So at present, there aren't any particular actions at risk. It's just that some of them are not at a stage where we can provide a meaningful update, or others may not have necessarily been at the stage of starting as yet.
Thank you very much. Do we have any questions or comments? Oh, one question from Bev Nicholson. Yeah.
Fine. I done that right? Yes, sorry. It wasn't a question, just a comment really, that I've been working really closely with Amanda and the public health team in relation to the tie-in with the integration board for the priorities. And we've been talking a lot about mental health and low-level mental health, and actually Lara Stavrenou and Dana White from her team are leading on a project for low-level mental health that's one of the RIB priorities. So just wanted to demonstrate really how that's all tying together, and we're working really collaboratively to make sure that we don't have duplication and we all benefit from that, and mainly residents and people suffering get the benefit of that as well.
That's really good to hear, very positive. Thank you.
You're welcome.
Right, okay, thank you very much then, Amanda. Thank you for your presentation today. And are we all happy to approve and there's recommended action? Yeah, just note the report. Right, thank you very much. Right, okay, so final agenda item is the date of next meeting, which is the 7th of October. And if there isn't any other business, we're finished. So thank you very much. Thank you very much, everybody. Bye.